The fight against cancer is entering a new and exciting phase. Researchers and doctors are beginning to understand cancer and each individual cancer patient in far greater detail. These advances are enabling a much more personalized approach to cancer treatment. Cancer patients in the future will each experience a different, personalized treatment approach with the promise of significantly improved outcomes. What could the future of personalized cancer care look like? Meet Linda. Linda is a 62-year-old former smoker with a family history of lung cancer. Because her family history puts her at a higher risk of developing lung cancer, Linda's doctor sequences her DNA to test for genetic predisposition to this disease. This test reveals that Linda does have an increased risk of developing lung cancer. Linda sees an oncologist who prescribes annual checkups based on a technique called liquid biopsy. This non-invasive technique can detect traces of cancer in Linda's bloodstream and enable early detection of disease. Several years later, one of these liquid biopsy tests detects tumor cells in Linda's blood, indicating the possible presence of lung cancer. Unfortunately, further testing confirms that Linda has early-stage non-small cell lung cancer. Linda's oncologist orders several advanced diagnostic tests of her tumor, including multiplexing immunohistochemistry and next-generation sequencing. These tests reveal an abnormal pattern of protein expression in the area immediately surrounding the tumor, as well as the presence of several key genetic mutations. Linda's oncologist uses special software to help select a personalized treatment plan for her. The software compares Linda's profile, including her medical history and the results of the advanced diagnostic tests, to a comprehensive database of clinical literature and medical guidelines in order to identify the most appropriate treatment options. The software also compares Linda's profile to a massive library of data from other cancer patients, finding those people who had similar disease and generating insights from what happened to them. This sophisticated analysis identifies specific treatment options that Linda is most likely to benefit from, given her unique cancer profile, as well as a number of clinical trials in which she would be eligible to take part. Linda's oncologist carefully reviews these treatment options and their supporting evidence. She discusses these options with Linda, and together they agree on a personalized treatment plan. Linda begins a treatment regime of 2 targeted medicines that have been approved for use against her specific cancer type. Throughout her treatment, Linda's blood is tested regularly using liquid biopsy to detect response to treatment or disease progression. These tests show a positive response. Linda's tumor shrinks and after a few months is no longer detectable. Improvements in diagnostic techniques and treatment approaches, the collection and analysis of data from electronic medical health records, and sophisticated clinical decision support software will enable us to create increasingly personalized treatments for cancer patients like Linda. Personalized healthcare will help us to provide the best possible care for each patient, and that is progress in our fight against cancer.